Welcome. I'm Mark Lagon, Chief Policy Officer at Friends of the Global Fight Against AIDS, Tuberculosis, and Malaria. We're here for this forum about the future of the Pandemic Fund and the important work of preparedness and response to pandemics of the future, which are inevitable. And it's on the occasion of Transparency International putting out a report to look at the importance of accountability and transparency in pandemic preparedness and architectures set up internationally to serve that goal. We're lucky today to have four marvelous panelists. Elisha Dunn-Georgiou, she is the Global Health Council's president and an executive director, as well as a Pandemic Fund board member, the principal civil society organization's representative for global health. She spent more than 20 years advancing political will and increasing resources for policies and programs to improve the health of communities worldwide. Over here we have Allan Maleche, who's the executive director of the Kenya Legal Ethical Issues Network, or KELIN, focused on HIV/AIDS. And he's a former board member representing developing country NGOs on the Global Fund to fight AIDS, TB, and malaria on its board. And he's co-chair and member of the UNAIDS Human Rights Reference Group. He's an expert on work on HIV, AIDS, and tuberculosis in his native Kenya. Dan Peters is Senior Program Officer for Development Policy and Finance at the Bill and Melinda Gates Foundation and brings deep experience in development finance and accountability in his work. And Sara Bandali is Director of International Engagement at Transparency International, and she oversees Transparency International's programs on global health and defense and security. Prior to joining Transparency International in 2022, she was Director of Design and Innovation at Options, working on improving maternal, newborn, and child health, quality of care, sexual and reproductive health, and health system strengthening. Well, let's get right into it to discuss how to advance goals of pandemic preparedness and response, but look to accountability, transparency, and a voice for civil society being served. Elisha, let me begin with you, if I may.
Sure.
As you're on the board of the Pandemic Fund, how should the Pandemic Fund be organized to ensure that critical civil society voice isn't overlooked or ignored, especially civil society organizations in the Global South, those that will be recipients of funding? As one of only two civil society organization representatives on the board of the Pandemic Fund, how are you addressing existing barriers to civil society participation?
So an easy question. Thanks very much, Mark, and thanks to Transparency International for having me. So as Mark, you said, we have 2 voting seats on the governing board of the Pandemic Fund, 2 primary reps, one me for the Global North, and my colleague Jackie Chiari from AMREF is the representative for the Global South, and each of us has an alternate. So I would say in terms of structure, having a voting seat is the first important step. I think that really does make a difference in the power and contribution that civil society can make. And it's not that common to have a voting seat. I mean, Kaiser Family Foundation did a really great paper recently looking across, I think, 14 FIFs multilaterals to see sort of how civil society participates and whether they have voting seats or are observers or have some kind of relationship with the governing body. And what they found is that I think there were 5 or 6 among the 14 that had some kind of voting seat. Global Fund is one of those. And that really increased the participation and impact that civil society has in terms of the governance structure. So that's a really key piece. I think, the Pandemic Fund is new, stood up in September. We're all really excited about the potential opportunity for its additive value to the global health architecture. We've been focused a lot because of its newness on the governing board piece and the role that civil society plays there. But I don't want us to lose the country participation of civil society as we move into the applications and the call for proposals and eventually the implementation of what gets funded through the first call of the pandemic fund when that's announced. And in that, I think, again, referring to this Kaiser paper, the challenges are similar across all of the FIFs and multilaterals for civil society participation. I mean, a big one is funding. You know, we're asked to volunteer our time to do this. It's maybe a little bit easier for well-resourced organizations that kind of play at the global level, but it's still, you know, free labor, essentially. It's even more challenging for participation of civil society and NGOs at the country level or regional level, however, particularly in lower and middle income countries. There really needs to be a consideration of how participation is resourced. And there are some mechanisms, again, just referring to Global Fund, the CCMs, which I'm forgetting what the acronym is.
Country coordinating.
Thank you. I couldn't remember the second C. Country coordinating mechanisms do have a stipulation about reserving a percentage of funding to engage civil society constituencies, and I think that's a really important mechanism. And of course, it has to be intentional that civil society is included and invited in, ideally from the co-design process, and that doesn't always happen. So I think we're making progress with the voting seats, certainly, but there's still room to make it more equitable and more inclusive as we move forward with the fund.
Great. Well, you're going to provoke some good exchange here on some of those key issues. Allan, what are some of the key governance features needed to ensure that the greatest benefits are experienced at the country level by those who need it? Are the pandemic fund internal governance mechanisms sufficient as you see them to realize maximum benefits and mitigate corruption, something you and I have talked about over time? What can be done to improve those mechanisms or make them work in lived reality?
And Mark, you said I have how long to respond to this? I may need more than a day, but I'll thank you for the question. It's really a thought-provoking one, and I want to start off with where Elisha left the conversation, and to just emphasize the big win of having permanent civil society representation on the FIF fund is a big win, because based on the Kaiser Foundation study that you're speaking to, the World Bank and WHO are one of the remaining entities that do not have any formal permanent representation of civil society. So I think that's the first structure that comes into place, Mark. The ability to have permanent and voting representation of civil society implementing countries on a funding mechanism such as FIF is an important feature to be set up. I know it may be too early to give an analysis of where the FIF structures are, but drawing from my experience from the Global Fund, it is important that you have structures at the board level that have got people who have actually had the practice of implementing the things that want to be done, so that they can provide the lived experience and the necessary guidance around how do you structure mechanisms and get funding to groups and governments and entities in a way that they actually maximize impact. And in so looking at it, and particularly addressing the issue of corruption, which is inevitable in cases of funding both implementing and other countries, it's important that the FIF considers an approach that tries to look at preventing corruption, anticipating the risk of corruption, rather than taking the approach many other global bodies have taken of arresting corruption after the fact. I think our experience as KELIN and our experience working on the Global Fund board has demonstrated that even though you'll recover your money back, say the government will have to pay it back, civil society will have to pay it back, the harm that is done to the human lives as a result of someone missing vaccines, someone missing ARVs is much more detrimental than the money you get back. So if the FIF, and my word of advice to them to begin with is to anticipate that corruption is going to happen, how do we assess the risk, and how do we start looking at preventive mechanisms rather than curative mechanisms, so that that safeguard is important to ensure that the resources actually have the maximum impact, because we know when money is lost through leakage, wastage, and corruption, then it affects more lives. So I think that would be the starting point, but they need to ensure at the board level, at the committee levels, and depending on how they will disburse monies to the countries or implementing partners, there needs to be structures in place that allow for those checks and balances. And lastly, and most importantly, I do not know whether they will be relying on the independent mechanism of the World Bank, but I think having a structure like the Global Fund does have, of the Office of the Inspector General, or drawing from all the Inspector Generals, say from all the implementing agencies, Global Fund, WHO, World Bank, would be a good way to coordinate to ensure that this is given priority. Back to you, Mark.
Thank you. And that balancing of risk, which is necessary, there has to be some appetite to take the risk to provide for pandemic preparedness. And yet, it's so crucial for maintaining trust in society. We know from COVID-19 that poor information or lack of trust in mechanisms in society prevents the impact that we want. Dan Peters, from your perspective, as a non-sovereign contributor to the pandemic fund, that is the Bill and Melinda Gates Foundation, how can we avoid further fragmentation of the global health financing priorities and prevent the overlap of the mandates of the pandemic fund and other global health funding mechanisms from being unhelpful as opposed to helpful?
Great, thanks, Mark, and thanks also to Transparency International for doing this event today. So I think this is a topic that the foundation is keenly aware of, given that we're investors in other global health institutions like the Global Fund, like the Global Financing Facility at the World Bank, Gavi, CEPI. So we're very aware and want to avoid further fragmentation. There are a couple of points that I would keep in mind. I think, first of all, we also need to recognize that the amount of funds that the pandemic fund currently has are really relatively modest. While it's impressive that we've raised $1.6 billion in pledges to date from, I think it's 24 or 25 donors at this point, that's much less than what the UN high-level panel recommended in terms of an additional $10.5 billion of spend each year on pandemic preparedness. So when we think about that 1.6, we need to be extremely targeted and demonstrate impact. So I think that's the first point. And so how do we use that and prevent further fragmentation? I think we need to look quite closely and make sure that the activities of the fund are complementing what other actors in the system do. And again, these other actors like the Global Fund, like the World Bank, that have much more financing actually already in pandemic preparedness. So we need to make sure that the pandemic fund is complementing that work. And I think, so we need to look at the specific activities that the fund will take on. What is it doing at a country level? What is it doing at a regional level? And making sure that we're not duplicating what those other actors are already doing. And I do think we've seen other similar funds, unfortunately, where the fund does end up duplicating what other actors in the system already do. And so that's going to be a crucial lesson that we need to take a look at and make sure that that doesn't happen with the pandemic fund.
I'm looking forward to returning to you in the rounds of questioning. Sara Bandali. What are some of the identified corruption-related vulnerabilities of large global health financing mechanisms from experience? What's the impact on outcomes at the country level?
Thank you. And just building on what my panelists said, I just want to say we welcome the fund's intentions. We think they're important and can serve an important catalyst to building health systems resilience in countries, not just for emergencies, but also long-term viability of health services. But we know that there are vulnerabilities within health financing mechanisms. Specifically, we know that the intentions of other health financing mechanisms haven't achieved their full potential because of vulnerabilities related to corruption, lack of multi-stakeholder input, and lack of country ownership. So we do need to build on the lessons from COVID-19, as well as other health financing mechanisms to ensure global equity. I'd like to point out that there is evidence showing that there is a higher risk of corruption as the speed and as the value of funds are deployed to countries. And the very nature of the pandemic fund is such that it is responding to emergencies, and so it is potentially vulnerable to higher risks. So putting in place measures to address that before emergencies hit will be of critical importance. Another point I'd like to pick up on, which panelists have also raised, is the potential of diverting these funds from the pandemic fund away from existing health priorities and needs. And we already know that the health financing architecture is already fragmented and can be quite complex. So it would be very useful to have full transparency on how the pandemic funds are being used in a way that complements existing health priorities but doesn't take away from them. So I think one of the messages to wrap this question up with is we know strong transparency mechanisms go a long way to address corruption, to minimize it, and to ensure that all funds are accounted for. So we would like to pull out some key recommendations for the pandemic fund, and that is around signing mandatory agreements in fund disbursements, and including integrity, transparency, and anti-corruption clauses in the agreements between the fund and implementing bodies. And we'd also like to build on the successes of the World Bank's open data infrastructure and develop those to create an end-to-end system that allows tracking of fund expenditure, funding flows, results achieved from national to global levels. And finally, is a means of ensuring the greatest transparency possible is the publication of all contracts, their tendering, but also their awards, as well as independent audits as well, which is a key step in facilitating greater transparency with the use of the pandemic funds.
Excellent. Interesting things in operational work to come. Those of you who are participants online, in a few minutes, roughly at 40 minutes past the hour, we'll move to questions from those of you participating. Look to submit questions by the chat box. You can even begin sooner than when we start, so as questions arise, submit them, please. Until then, we're going to continue with a round of questioning. Elisha, back to you. How are civil society voices currently being captured and integrated in the decision-making for the pandemic fund in its young life so far to ensure that the fund addresses country and beneficiary level needs? How's it different or similar to existing or past funds for global health?
So I think there's multiple answers to this, or multiple parts to an answer. I mean, first I would say it is nascent. So I think many people know this, but just in case, we have a permanent voting seats. That is correct. We are right now in sort of an interim period. So I'm an interim civil society rep. And there is a kind of planned, I'm calling it a reset, I don't know if that's really the right term, but in April of 2023, when permanent civil society reps for a 2-year period will be elected to the governing board. So we've had, I think, quite a good mobilization since we learned about this fund was going to happen. And prior to the fund being set up, there were several consultations held with civil society, led by Pandemic Action Network, Walkie Health, and others, trying to get at some of the key characteristics and concerns that civil society very broadly across the world would want to see as part of the fund's governance structure and funding structure. Since then, as the interim civil society reps, we've have kind of regular consultations with a group of civil society that is a mix of northern and global southern civil society who really form sort of a support group that help with language and inputs and just making sure that we're representing the technical skills and perspectives of civil society and communities. I want to make sure we're also saying and communities, because that's not always captured with just civil society. And then we've also been doing sort of feedback with town halls on a regular basis that are open to any civil society and community group that wants to participate, and the board members, the civil society board members are there to provide, as much feedback as we're able to. In terms of the internal process of the governing board, I would say, from my view, this is the first time I've sat on a governing board for a multilateral FIF, but the board has been very open and receptive and very collaborative with civil society. The Secretariat is very supportive of our participation. And I would say for the civil society reps, both primary and alternate, for us, we understand, I think, the magnitude of what we're representing, that it's not just civil society for the FIF and what happens with the FIF, but to have this voting seat on a World Bank mechanism has longer-term ramifications, right? So we have very intentionally shown up prepared, ready to interject, ready to make comments, feedback on the gazillion documents. I think it's even more than a gazillion that have been circulated. But I think that has made it somewhat of a heavier lift at this point, because we understand that our representation is sort of beyond this, and how we act and participate in this FIF could mean more voting seats or no voting seats on things moving forward. And that's not to say that we are not strongly voiced and clear on our opinions as civil society, and we definitely raise concerns when we see things that could be detrimental, but I think, or can be improved. But we really went in the mindset of, we've accepted these seats at the table, and so we have to make this better than it would be if civil society wasn't here.
Excellent. There will much be talked about when the scale of the funding is beyond that Dan has talked about, and that there are actually rounds of disbursements. Allan, from your experience, how does the internal governance of global health funds impact the benefits experienced derived from funds at the country level? I know you've had to read all those documents in the governance of the Global Fund when you served on its board. But how are those internal governance arrangements and culture over time important to the benefits on the ground?
So, Elisha, let me start off by saying the documents don't get lesser, and they get much more technical and what is important as part of the governance process and the culture across the board is to find a mechanism that supports the civil society representatives on that particular governance mechanism, because you're dealing with governments or you're dealing with donors who have got support from their teams, people who will read the papers, people who will check the T's, cross the I's, and cross the T's, as they would say. But on the part of civil society, you're drawing from your own experience. And so finding a mechanism, and I know the Global Fund has done it before and continues to do it, that allows for some level of support for civil society to also have people they could get from among themselves in civil society who have the different expertise that can dedicate time to look at the documents and engage with them when they come to the board. So I think that's one important feature that we really have to strive to push for within the FIF and outside of the FIF, of a mechanism that helps full engagement and participation of civil society. I think internally we need to carefully navigate the relationship between the board and the secretariat and the implementing partners. I'll generally call them implementing partners for now, because there seems, from my experience, sometimes broken conversations between what the board says, how the secretariat understands it, how it's communicated to the country, and eventually what is reported back to the board, so that you're almost in a cycle of saying, but this is what we asked for, why is it not moving? And so if the FIF can get it right in terms of ensuring the message from DC is actually the message that gets to Kigali, it's a message that gets to Bangkok, it's a message that gets to Nairobi, and the implementers in Nairobi clearly share that vision is important. So that communication and the Secretariat being able to break down the aspirations of the board in light of a specific mandate, as Dan mentioned, we do not want to see duplication, but we want to see FIF carving out its niche so that we can know this is what World Bank did, this is what WHO did, this is what Global Fund did, and this was the value add of FIF. So again, being able to craft through policy documents, through strategy documents, to weave that through is especially important. And then just to conclude by saying, I still want to emphasize the importance of leveraging on the existing offices of Inspector Generals across the board, from the US, from World Bank, from Global Fund, from Gavi. I think the FIF would benefit a lot in terms of seeing how they can collaborate with those offices, because many of them already have links with players at the country level, and that is extremely important. So a lot could be done, but those are the ones that come to mind at the beginning.
You raised so many more questions with your rich thoughts. Thank you. Dan, back to you. There's concern that the resources needed to achieve the budget set out for the pandemic fund may not be achieved, or they might be derived from budgets allocated to other financing mechanisms. How can that be avoided?
Yeah, thanks, Mark. And before I turn to that, I just wanted to pick up on a couple other things the other panelists said. On the participation from CSOs, that's something that the non-sovereign constituency was strongly supportive of, and other board members were as well. And I do think that our CSO representatives have shown the wisdom of that decision, because they have been very active in discussions so far and bringing good ideas to the table. So I think we're glad that happened. So I just want to emphasize that point. I think on the funding again for the pandemic fund, again, the fact is that we're well short of what the high-level panel had recommended in terms of funds that would be available for pandemic preparedness and response. So I think for the pandemic fund, to try to ensure that we do mobilize those additional resources, there's a couple of things that we want to keep in mind here in the first year of the fund. I think, first of all, we need to ensure that there are clear priorities for early funding. And I think that we're seeing progress in the discussions amongst the board members about what some of those priorities might be. So I think we're seeing progress there. We need to have a clear results framework for the fund so that we can explain the impact of the fund and its activities. Again, there's a board working group that's making progress on this. I think another challenge that the fund needs to look at is we have a very wide eligibility of countries. 144 low and middle income countries are eligible for pandemic fund financing. And so we have to resist the pressures to spread funding thinly across many countries. Really need to figure out how we can make deep investments that complement what other agencies, like Allan was saying, are doing, and making sure that those activities are coordinated so that we can go back and request additional funds from the donors to the pandemic fund. And then finally, I think we're obviously still in the initial phases of getting the pandemic fund set up. We're hoping to do a call for proposals early in 2023. But I think we also need to work on the vision for the medium term for the pandemic fund and where it's going. Again, we have a very crowded global health security landscape, and so how this piece fits together with the others is going to be a critical task that the board's going to need to tackle in the coming months. Thank you.
And it seems to me that the pandemic fund should use some of those others, not necessarily sap resources from them, but in the right cases, fund some of those. Sara, back to you. What sort of anti-corruption, transparency, and accountability mechanisms should more specifically be part of the pandemic fund's internal governance? Let's go down a level of a deeper specificity. Ensuring effective oversight of the fund's allocation and implementation afterwards depends on such mechanisms.
Yeah, sure. I'll start with anti-corruption. So I think in addition to sort of open contracting principles and integrating integrity and compliance into the actual contracts, we would also encourage that anti-corruption, transparency, and accountability approaches and measures are also integrated into the rollout of the programs themselves. Because we know that very crude estimates suggest that $600 billion annually is lost to corruption in health each year, and this is from a handful of countries in the West, so it's a huge underestimate of what we know is lost, and I think the Pandemic Fund, by its very nature and intention, can avoid some of those pitfalls. I'd like to come back to the point of accountability, because I do think that the ability to open up to civil society space is absolutely crucial, but we also must recognize that within bringing together multi-sectoral stakeholders, there are differences in terms of the incentives and the power and the influence that each of these groups do bring, and I think we just need to take that into account and make sure that we cater for that at global level, but also at national level. What we would also encourage is once funds, or actually before funds even hit Treasury in countries, there are very strong existing, if they don't exist already, national accountability mechanisms set up that really open up the space for implementing bodies, but also really the voice of indigenous civil society. And we think that that's absolutely crucial, because through that you can ensure that there's an integration of local needs and priorities from these countries into the design and the rollout of funds that are being used for this purpose. And I think that ensuring that there's an independent body to monitor how those funds are being dispersed, but also tracking whether those funds are being effective, efficient, but also we're achieving the outcomes that were intended is absolutely vital as well.
I would pose what might be called a speed round question for each of you. Just a last thought before we move to participants online. There are obviously very technical benchmarks that the Pandemic Fund is designed to deal with, and specific gaps to be filled, strengthened surveillance, strengthened laboratories, and so on. In terms of serving the needs of indigenous civil society, and for that matter, local healthcare workers, do you see any dangers of the Pandemic Fund not concentrating on health system strengthening generally? Is there anything about holding to account a process of strengthening health systems in general that isn't necessary?
This is for me. It's my speed question.
You all will have the same question.
So,
Is there a thought you have to share?
So I would just say I am not a technical implementer, right? I'm an advocate. So I'm going to actually say that I think there are so many gaps, right? I mean, we know there's a tremendous amount of need, whether it's in surveillance, whether it's health workforce capacity, health system strengthening, and I would say surveillance is a big component of health system strengthening. I think we tend to look at or think of health systems at the point of service, but there are so many other pieces to that around governance, around labor equity, gender equity that go into that. And since I'm not a technical implementer, I'm not going to pick and choose among those. But I think that really needs to come through in the call for proposals. And that there's options on the table right now of how countries participate and how inclusive the process is to engage communities and civil societies in the application process. What I will say is that all of this is dependent on political will, and that health is a political choice. And so we have to have that, and we have to have the backing of that high up in country to really make this work. And I think we've been very focused on tracking the technical piece, but there are other things that we've been recommending are included in the results framework and the co-financing models and for the implementing entities around really those principles on accountability, transparency, and inclusivity that speak to how well does the governance model, and not just at the governing board level, but the governance model in country work in favor of those most marginalized.
Thank you. I've unfairly asked you to make a brief comment on a general question, but do you see any tensions between technical needs of pandemic preparedness and response and general health system strengthening as a way of serving local civil society and caregivers? Any thoughts on?
So I think I'll start from the point that we must always remember that each country has a responsibility to deliver the right to health to its citizen, and many of them have signed and ratified and legislated documents that affirm that. And so as we approach the FIF funding going to countries, I think the fundamental question to ask is, what is the value add that the FIF funding is bringing on board, rather than what is the FIF funding coming to fix? Because there's an expectation that the government of the day should have made progress towards realizing the right to health. And so I would take the conversation from the perspective and possibly even make it a requirement that each country should audit their health system as it relates to pandemic preparedness and indicate what are the gaps. And based on that analysis, and maybe it could inform the fundraising process, you're then able to see what may be easier for the government of the day to pick and what may be easier for FIF to either catalyze or to take up and set up completely with the view that the government will be able to take over. So I think it's important to have those conversations happening between government agencies, the FIF body, but also including civil society, because health system strengthening, whether it's technical or not, needs a perspective of civil society. Whether you're setting up a lab, whether you're setting up a surveillance system, you definitely need the feedback of the users of the system. And so dialogues of that nature would be important as we try to figure out what is the best way to fund countries and to what specific issue. But keeping in mind, at the end of the day, countries owe their citizens an obligation to deliver on the right to health for them.
That was a question probably more suited to my colleagues over here. Are there any brief thoughts before we move to our online participants that you have along these lines?
I think quickly, just building off of what Elisha and Allan were noting, I do think health system strengthening is something that the Pandemic Fund Board already has clearly in mind, and in the mindset, again, of how do we complement all of the work that already happens on health system strengthening. I think it's important to, again, note that the World Bank, Global Fund, WHO, these are all agencies that are deeply involved in this work already, not to mention the enormous investments that countries themselves make in this space. And so the important thing is, how does the Pandemic Fund support and complement that? Working from things like the national action plans that countries are developing or have developed. And I think one example of this already is there has been a lot of discussion at the board around the idea of integrated disease surveillance. How do you help support pulling together the different disease surveillance activities that already take place to improve outcomes? So I think there are real opportunities here for the Pandemic Fund to complement and support overall health system strengthening activities and not duplicate them.
Thanks, Dan. Sara, anything?
Yes, I would just like to say there is a potential risk for the fund to be directed at single cause issue, which is a very important issue. But I do recognize, and it's good to hear, that there's a holistic, what is the attribution of this fund to achieving universal health coverage, and making sure we're not setting up parallel systems. So, for example, the national accountability structures, I've mentioned, they exist in many countries. Make them have that wider vision around health system strengthening and health for all. But I think it's a really unique opportunity for the fund to be able to catalyze and trigger some of those responses, in addition to the other funding mechanisms that are out there, to really focus on the systems that you need to ensure resilience is built within countries to respond to acute emergencies, but also ensure that they can protect their citizens from the longer term issues as well.
We have some great questions from those who are participating online. I'm going to try and direct them to panelists that, in my mind, fit all the better. I might ask Elisha and Dan this question. We've seen trends among recipient governments over time that governments are under budget in certain areas in anticipation that donors will come in with health funding in those areas. We've seen that with HIV programs in African countries. And then government funds are sometimes diverted to other corruption-friendly sectors. How can we learn from the past to ensure this doesn't happen with the pandemic fund?
Oh, me first.
Briefly.
Yeah, I mean, I think it's a complicated question. I mean, when we say, you know, recipient countries don't budget and just wait for donors to fund the coffers, you know, I mean, it's the donor countries that set up that expectation. And once you have, you know, started pouring millions and billions of dollars into a particular field, it's very hard to reverse that trend without some intentionality and, you know, expecting, I think, country governments that are just do not have the resources domestically to fund what I think we all know is the right amount for health per person. Something like $87, I think, is the you know, whatever the GDP analysis is for UHC. So I don't want to sort of lay the blame here. I mean, I feel like that is a little bit laying the blame on recipient countries. There has to be some kind of dialogue about this, and I think there's a process in place within the pandemic fund to look at co-financing, especially to make this money, again, additive and complementary and fill gaps, not to create, as Sara said, you know, repeating systems that already exist, or building new systems when really we could be investing capital into a country's health system in a way that they need it to be invested. So it's nuanced question. I recognize the issue we're all concerned about is corruption and diverting of money to things that don't actually then, it doesn't reach communities and the people that need it. But I think the first step for that would be to be very transparent about that conversation, which we're not always. So I appreciate that question because I think it does open a dialogue about it. But there's a lot of layers there that I can't address in just two minutes.
Allan and Sara know that I'll be coming to you with the next super question that I've seen. Dan, what do you have anything to say from past experience about recipient governments, low and middle income country governments that underfund certain things in anticipation of donor funding or divert funds to things that are somewhat more corruption vulnerable?
Yeah, no, thanks, Mark. Maybe just building quickly off of Elisha, I think that the international community actually has quite a bit of experience in thinking about these issues. So institutions like Gavi already do have in place a co-financing policy to ensure that governments and Gavi are aligned in terms of funding the immunizations for children. So I think we have that in Global Fund as well. Certainly the World Bank also thinks about the long-term financial sustainability of investments it makes and looks at what how governments themselves are investing in these areas. So I think we have a rich body of evidence. And again, as Elisha already noted, the Pandemic Fund Board is also thinking through a co-financing policy, you know, to make sure that the fund and countries that are committed to addressing gaps in their pandemic preparedness architecture are working together. So I think we'll see additional progress in this area.
Thank you, Dan. So next question I'm going to direct to Sara and to Allan. And you've touched on this, and this gives you an opportunity to go deeper. How can communities, health workers, and intended beneficiaries be included in the downstream implementation of activities funded by the Pandemic Fund so that the funds reach their intended target and accountability?
Yeah, good question. And I think it builds on a lot of what Elisha said as well, is that it is both a political and a technical issue. And I think we need to open up the space for communities and citizens themselves to input into the prioritization of where those funds go and how it addresses their needs. So I think it's not just a tokenistic participation in these dialogues, but it's actually meaningful engagement, and that actually entails sometimes doing a bit more to bring all the stakeholders up to speed with regards to information, open communication channels, but also the resourcing that they need to participate meaningfully in these types of discussions, rather than just symbolically having a so-called seat at the table.
Allan.
Thanks. I just want to circle back to the first question, even though it was not directed to me, and just say that I think two things come in mind for me on the issue of ensuring governments put money where they need to be and don't pick the soft issues. I think the first point I'll say is priority setting, and the priority setting in a sense that, as Elisha said, there's a level of dialogue that's happening between the government, civil society, FIF, and other funders who are involved in the process. I think that's important. I think co-financing is a very good and strong policy, but my experience on the Global Fund Board has been many countries have not honored it, and sometimes because of our diplomatic relationships with countries, sometimes the funds do not want to raffle certain governments in a certain way. So I think the advice to FIF is to say, do have the co-financing policy, but find a way of ensuring that it's actually enforced, because a few countries have lived through it, but many have fallen short of what is expected. So I think there's some lessons to learn there. But coming to the question that you raise, I think it happens at 3 levels. I know Elisha and my colleague Kiarie from AMREF have done a good job to have 2 seats, but also the Global Fund began by having only seats from NGOs from the Global North and the Global South, but eventually they found it important to have a seat for communities. It may be a direction that the FIF may want to take, because I know everyone will say they're affected by pandemics, but I think it's important to think through, is there a possibility of seeing representation of actually affected communities on this governance process as a starting point? Because from my experience at the Global Fund and even in UNAIDS, having the voices of those who are affected on the table really shapes the conversation in a different direction, because we have to admit everyone has vested interest in terms of who they want to see funded, what they want to see funded, and everyone is there with a particular position, be it your government position, be it your organization position, but communities come there with a position of how does this affect our lives. And so the board being very articulate to the Secretariat and to the implementing countries or partners around the need to have civil society involved, the need to ensure they are meaningfully engaged, and putting in mechanisms to ensure that they actually participate would be a key step to making that happen. And not only participate in the negotiation of the funding, but in the implementation, in the oversight, and monitoring the implementation of it through the structures Sara talked about at the national accountability structures. How do we get folks who deal with hardcore corruption, transparency issues to now develop an interest on health issues, and to be concerned that their governments are getting money that would save them from the next pandemic or help them prepare for it better? So how do they develop, and how do we stir their appetite to want to keep a close eye to what the government is spending and what the government is actually receiving, so that it gets to the people that need it?
Thanks. I see some questions from our participants online suited to particular members of the panel. Elisha, let me ask you this one. Political memories and interests are notoriously short.
Is there a question in there?
How do we ensure that governance lessons and learnings from the COVID era aren't forgotten and we don't end up unprepared for the next pandemic?
Well, I think that one thing we all need to get better about is documentation. I mean, I think that's another really key reason to have civil society and communities involved. I think Sara and Allan have both touched on this, but that accountability piece and really ensuring that those lessons learned are carried forward and shared. I think that sharing piece is often where civil society, we fall flat on that we don't kind of uplift the message, in part because we don't have the resources to do that. And I think civil society and communities get funded quite a bit to implement technical programs. Do we get funded to do advocacy and maintain that documentation and share lessons learned and really build that movement around accountability and inclusivity that's so needed, so we don't lose those political lessons. I mean, I think there is an inherent piece of this that political regimes and administrations turn over. And so going from one to the next always creates some kind of a hiccup in the flow of information and memory. So you need a multi-stakeholder platform at each country to keep that going, to keep those relationships built and in place. It's an excellent question. I think that we don't always share the lessons learned in a meaningful way and in a targeted way that resonate with the audience we're trying to reach. That sometimes it's like a brain dump of everything that's happened, and it's too much to absorb, and you really need to think through, again, with intentionality, what lesson are you trying to communicate and to whom, and how is it best to do that?
Thanks. I have a question for Sara and Dan. There have been concerns from the international community, not just about the intent of the donors to the pandemic fund or the importance of civil society, as we've talked about in some depth here, but the implementing countries themselves, having enough of a voice in the priorities of the fund. How should that be dealt with in coordination? It picks up on some things you've been saying before.
Thanks, Mark. So I think it is critically important that the co-investor countries, as they're known on the board, have a strong voice in the priorities that are set by the fund. I think we've already taken important steps in this direction. So first of all, just to remind the audience that co-investors are represented on the Pandemic Fund board and in fact make up nearly 50%. They have an equal number of seats as donors do on the Pandemic Fund board, so I think that's quite important to keep in mind. I know that we're going to have the head of our secretariat, Priya Basu, up here in a moment, but I think that the secretariat has also been doing a lot of work to try to make sure that our co-investor board members are fully informed and can review the billions of documents that Elisha was already mentioning, because it is quite a bit of a documentation. So I think doing that kind of outreach and making sure that co-investor board members are fully up to speed is critical as well. And then I think that the call for proposals process itself will help to draw out the priorities of co-investor countries through what they're looking at funding through their own national action plan. So I think we have several different levels where we can make sure that the voices of co-investors are strong in the Pandemic Fund.
Sara Bandali.
Yes, maybe just to build on that, I think we need to think of accountability as bi-directional. So there's the funding coming in from World Bank and other funders, and there's accountability for how those funds are being deployed and used. So a value for money argument needs to be very strongly articulated there. But also from the implementing bodies and the citizens that are directly affected, they need to make sure that localized needs are actually respectively incorporated and weaved into the realities of where that funding is going. So I think having a very strong feedback accountability loop will be critical to ensuring that we have very strong voice and accountability from all stakeholders.
Allan, you had a question directed to you specifically from someone in our audience. Can you think of one thing at the country level that really it could be done that's most important for managing risk of corruption, particularly something that civil society organizations can help with?
I think it would be having multi-stakeholder dialogues among different players who have a role to address corruption. So I would see the ability of civil society working close with government agencies such as the judiciary, the Office of the Director of Public Prosecutions, the media, the law societies, just trying to think through who are the players in the framework and how do we get them to be concerned about health as an issue of corruption, or rather corruption as an issue affecting health, and to get them involved in trying to safeguard the national resources, but also the investments that you're getting from various donors. So I think that's the one practical thing that can trigger conversation, can help people see that I have a role to play in terms of addressing corruption in the health sector, not just corruption generally, because it's much closer to home, having seen everyone affected by the COVID pandemic and what it has changed in our lives. So that would be my attempt to respond to that question.
Excellent. Excellent. Before we invite the executive head of the Pandemic Fund Secretariat to join us for concluding remarks, I just want to summarize some of the things that I think have been takeaways from this conversation so far. There have been contextual factors about relatively limited funding pledged so far, having impact on those things that do get funded, some tensions between general health system strengthening and particular technical things that the Pandemic Fund can fund. But a lot of our discussion has been about how a will to embed accountability and transparency and civil society voice at the board governance level translates into the disbursement of funding and use of funding on the ground. This rich discussion so far, made possible by the Open Society Foundations, has really shed some light on that. I'd like to welcome Priya Basu, who's executive head of the Pandemic Fund Secretariat. She's had some 24 years at the World Bank, where in the past she's headed development finance and was the inaugural head of the Women's Entrepreneurs Finance Initiative, known in the field as WIFI. We've had discussion here so far, Priya, if I may, about the importance of civil society voice, accountability, and transparency that you have helped embed in the initial framework. How do we have those come through in the lived practice of how funds are spent? Because the confidence of donors, the confidence of implementing governments, and the confidence of civil society in low and middle income countries depend on that.
Well, thank you so much, and thanks to Transparency International for organizing this event, and thanks to the panelists for a great discussion. Last month, we formally presented the Pandemic Fund. It's the Pandemic Fund, no longer referred to as the FIF, at the G20 Finance and Health Ministers meeting in Indonesia, and we held a very successful event on the margins of the meeting. We now have 25 donors, including governments and philanthropies, who've pledged 1.6 billion, and we're still actively fundraising because we know we have to raise more. I'd just like to emphasize a few points, and some of these were already made in the panel, and some perhaps I'd like to elaborate a bit more. So first of all, I just want to note that together with founding donors, with the WHO, with civil society organizations, and other stakeholders, the World Bank was able to develop the fund at record speed, but we did not cut corners. We consulted very widely and very intensively, and I think what you see in the governance of the FIF really reflects the excellent input that we got from a variety of stakeholders, and we've done our best to reflect those. And it really does show, this Pandemic Fund really does show that multilateralism can work. It is a testament to multilateralism, and that point was raised many times at the G20 meetings in a time when there are many sort of global challenges and issues. So many donors and partners did come together around something that's very important, building on lessons from COVID. Secondly, this is the first time that the international community has come together around a funding mechanism that's dedicated to investing in pandemic prevention, preparedness, and response for low-income and middle-income countries. There are many other organizations, including the World Bank, the Global Fund, etc., that do invest in PPR as part of the work that they do, but they're not dedicated to PPR. And we believe that, that through this fund, in the face of multiple crises and competing priorities, this fund will be an important tool that will help low and middle income countries become much better prepared for the next global health crisis. It will help the international community maintain a strong eye on sustained long-term financing for PPR. It will also hopefully incentivize countries themselves to prioritize PPR and increase their own efforts. So the political will at the national level and political will at the international level. So in this way, this pandemic fund, we believe, has a unique role to play in making the world safer. Investing in pandemic prevention, preparedness, and response is a global public good with benefits that are shared by all across borders. And every dollar that we invest now in strengthening PPR in low-income and middle-income countries will save lives and reduce financial costs for the world for the years to come. So that is one big lesson from COVID. Let's not fall into another cycle of panic followed by neglect. Let us invest now. Thirdly, the pandemic fund's governance and operational structure is grounded in the spirit of shared responsibilities that are needed to address global public goods. And you've talked about that today, but let me just reiterate a few points. First, its governance is inclusive. It balances representation from contributors and co-investors and provides a strong voice for civil society. There are 21 voting seats on the board, 9 of which are for sovereign contributors, constituency-based, 9 for sovereign co-investors, 1 for non-sovereign contributors, and 2 for civil society organizations, and Elisha is our representative from Civil Society Global North. Now, secondly, the operating structure is flexible to deliver support to countries and regions through existing institutions in a way that complements the work of those institutions and draws on their comparative advantages. And much has been said about, accountability and transparency on the ground at the project level. I just want to clarify, the Pandemic Fund is not a venture capital fund. It doesn't invest directly in projects. It invests in projects through implementing partners using their fiduciary procurement safeguard standards. And that is why much care was taken by the board of the Pandemic Fund to select 13 implementing entities to start with, through which funds will be channeled. Those implementing entities, 7 multilateral development banks, 3 UN agencies, Global Fund, Gavi, and CEPI, will use their own policies and procedures to prepare projects, to oversee projects, to monitor projects. They'll report back to the Pandemic Fund board, and the Pandemic Fund board will make all of that public. Thirdly, the fund structure incorporates, and this is part of it, high standards of transparency and accountability, building on lessons from good practice and many years of experience that the World Bank has in managing these financial intermediary funds. You can see all this in the Pandemic Fund's governance documents that are all published on our website, our governing framework, our operations manual, etc. I just want to say that there are financial procedures agreements of the fund. The trustee of the fund, the World Bank as trustee of the fund, is signing with all of these implementing entities, the 13 that I spoke about, and those will build in many of the points that I think Sara was referencing before. But really, there is a strong focus on transparency, accountability at the implementing entity level, and all of that will feed back into the fund and be made public. So much has been achieved in a short period of time, and there's lots more to be done. The fund's board had its inaugural meeting only in September, on September 8th and 9th, when the governing documents were adopted. And since then, a lot of progress has been made on many areas. As Dan mentioned, we have these 3 working groups, these 3 technical working groups that have provided recommendations on the results framework, on defining principles for project-level co-financing and co-investment, and on what the first call for proposals should look like. It's vital to get all this right so that the grants that the fund provides can ensure that resources are prioritized for projects with the greatest impact, reflecting strong ownership of at the country level, that the grants can catalyze additional financing, that they can incentivize countries to prioritize and invest in PPR, even though the benefits of those investments may not be so visible. and that the grants can be spent in a way that they promote cooperation and coordination amongst the various implementing partners. The fund expects to be able to announce its first call by January 2023. And with this time frame, we expect that disbursements for projects are likely to begin in May 2023. So it's after the disbursements begin, that's where you'll start seeing how we're reporting back on results. And I just want to say that equating government with countries may be short-sighted. This is something that the fund's board has also been highlighting. And so to ensure good governance, it'll be important that the pandemic fund, the proposals that the pandemic fund funds demonstrate engagement across key stakeholders, the point that Elisha was making, governments, CSOs, the voices of citizens, all of this has to come into play in the design of the projects that are submitted to the pandemic fund. And then to foster mutual accountability and learning, we will seek to encourage transparency and sharing of information during project preparation, during the selection and evaluation of projects. We have a technical advisory panel that will be evaluating projects, and during implementation. So, these fundamental principles of transparency and accountability that we talk about have to be throughout the life cycle of the fund, and we surely are committed to that. Because we recognize that greater transparency of information can help citizens hold their governments accountable on how funds are spent, and also hold civil society accountable. Civil society is part of the governance of this fund. So good progress has been made in forming the technical advisory panel, which will evaluate the funding proposals, and it will feed, as the name suggests, it will provide technical advice on what the fund should prioritize. This panel is chaired by the WHO. There's a selection panel right now that's reviewing the 300+ applications that we received for experts to join the panel as members. We can only select 20 of them, so that process is going on. And all of this information is going to be shared as the board concludes on its deliberations. I just want to say that this pandemic fund is a real opportunity to do things differently and help countries, regions, and the world mitigate the risk of future disease outbreaks, building on what we've learned from COVID, from our successes as well as our mistakes. There's no magic bullet when it comes to public health, but what COVID has shown us is that there is an urgent need to step up our investments in health systems and PPR capacities at all levels. And at the country level, there's a critical need to build disease surveillance, labs, public health workforce capacities, emergency communications, emergency coordination and management, and community engagement. So all of these investments are needed, and they must be sustained. And equally, we must build regional and global capacity for PPR. At the regional and global level, this can cut across multiple domains, including all of the areas I've just mentioned, to kind of network the data up and promote information sharing, regulatory harmonization, and capacity for the coordinated development, procurement, distribution, and deployment of countermeasures and essential medical supplies. We're confident that the Pandemic Fund will play a key role in helping to reduce risks from epidemics and pandemics in the most vulnerable parts of the world, contributing to a healthier, safer, and more secure world. And we believe that with the governance and operational structure that we have in place, we've gotten off to a great start. So thank you very much.
Thank you, Priya. I found this a rich discussion. My own career has had two lanes, one in the governance and human rights area. For instance, I was president of Freedom House, and in the last 5 or 6 years where I've been working on AIDS, TB, malaria, COVID, and future pandemics at Friends of the Global Fight. The issues that bridge those two areas have been addressed in trenchant ways here, whether it's talking about the role of civil society in co-designing how the funding of the pandemic fund should be spent, even funding for the participation for civil society, and how to grapple with the higher risk of corruption, which is natural in emergency situations when pandemics break out. I'd like to offer my thanks to the Open Society Foundations that have made this event possible, in particular to Transparency International for hatching this forum and for the report that it's just come out with to look at these questions of accountability and transparency in the architecture devoted to pandemic preparedness and response. I'd really like to thank our panelists who've been wonderful today, Elisha, Allan, Dan, and Sara. But in particular, I'd like to thank those of you who participated in this, who've come online or in person to join us today. Your questions have been great, and we hope this is only the beginning of a dialogue that experts, citizens, civil society, and people in the multilateral institutions will have on this question. And with that, thank you very much.